Does living abroad impact Medicare late enrollment penalties? Imagine planning your retirement and living abroad, only to find out later that missing a Medicare enrollment window could cost you thousands. It's a situation many seniors face, and understanding how living outside the United States affects Medicare late enrollment penalties is key. Medicare Part A, which covers hospital services, usually enrolls you automatically if you get Social Security benefits for at least months before turning 65. This automatic enrollment happens even if you live outside the U.S. So, if you are abroad but receiving Social Security, you will likely be enrolled in Part A without extra steps. However, Medicare Part B, which covers doctor visits and outpatient care, does not automatically enroll you if you live outside the U.S. If you miss your initial enrollment period for Part B while living abroad and do not qualify for a special enrollment period, you might have to wait until the general enrollment period to sign up. This period runs from January 1st to March 31st each year, with coverage starting July 1st. Missing this can lead to a late enrollment penalty. The Part B late enrollment penalty is 10% of the standard premium for each full 12 months you could have been enrolled but weren't. This penalty is lifelong, meaning it stays with you as long as you have Part B. So, if you delay signing up for a year, you pay an extra 10% on your premiums every month for the rest of your life. If you or your spouse have not worked enough to qualify for premium-free Part A, which requires 40 quarters of work, you can delay enrolling without penalty until you return to the United States. When you come back, you have a 2-month window called a special enrollment period to sign up without facing penalties. This rule helps expatriates avoid penalties if they enroll promptly after returning. Medicare generally does not cover health care outside the United States, so many seniors living abroad choose to delay Part B to avoid paying premiums for coverage that offers limited benefits overseas. But if you do not enroll when eligible and do not qualify for a special enrollment period, you could face lifelong penalties when you return. For prescription drug coverage through Medicare Part D, the rules are similar. If you do not enroll during your initial enrollment period or a special enrollment period while living abroad, you risk a lifelong late enrollment penalty. However, enrolling during your Part D initial enrollment period, even if abroad, helps you avoid this penalty. In summary, living abroad can impact your Medicare enrollment timing. Missing your initial enrollment period for Parts B and D can lead to lifelong penalties unless you qualify for a special enrollment period. Your work history and eligibility for premium-free Part A also influence whether delaying enrollment triggers penalties. Returning to the United States creates a 2-month window to enroll penalty-free. Since Medicare does not cover most health care outside the U.S., many seniors weigh the costs and benefits of delaying Part B and D, planning your enrollment around your return date, and coverage needs can help you avoid lifelong penalties and ensure you get the benefits you need when you come back home.